Hi, I'm Tammy Paletto, a veterinarian at Prescott Animal Hospital, and I'm here to talk to you about senior pet care. Senior Pet Month is November, and it's something that I'm very passionate about. I feel that age is not a disease, and I tell my clients that all the time. Being a senior pet can be different depending on if you're a big dog, a small dog. A bigger dog typically has a shorter lifespan than their smaller counterparts. And with cats, it's a little bit in the middle. I kind of consider a senior cat to be roughly 8 to 10 years of age. They typically will live into their teens, at least we hope that's the case. Larger dogs like Great Danes and Mastiffs, they typically live, a shorter lifespan, maybe 8 to 10 years, hopefully longer, and smaller dogs live close to their teens, but they are considered seniors by the age of 8, whereas their Great Danes and Mastiffs are considered seniors by the age of 5 or 6. Certain health conditions are more common in certain breeds of dogs, especially as they age, and so I do like to keep a lookout for those. And also in cats, the same is true. They can get kidney disease, thyroid disease, and with all of them, dogs and cats alike, dental disease is the number one disease in veterinary medicine. I think for our older pets, cats and dogs, I think that chronic pain and degenerative joint conditions like arthritis or disc disease are much more common than I think owners realize, and I think it's hard to know that when you see your pet every day. Sometimes people come in with the complaint of pain for their animal, but oftentimes it's something we pick up on during the exam, watching the animal get up and down, walk around, and cats are the notorious ones for hiding their pain. They're very good at hiding anything that may be wrong with them until oftentimes it's advanced before we recognize that there's even a problem. Because it's Senior Pet Month, Prescott Animal Hospital has been able to offer our clients a 35% discount on the senior screen, which is a very comprehensive look at internal organ systems. It includes a urine test, a urinalysis, a thyroid level, a complete chemistry, including 25 chemistry values, and a complete blood count. I think that is imperative to know where our pets stand as they head into their senior years. And I think if they're healthy, it's great to have a baseline. If there's a condition we're treating, it's good to check in on things and make sure our treatments are not causing harm. And I think it's also good to find out if we're missing anything, because we really can't help what we don't know is wrong. So we have to look for it. A lot of people, I think, are scared to run these tests because they don't want to know. But I really feel that knowing is power, knowledge is power, and we can help much more if we know the full picture of what's going on with your animal. I can't emphasize enough the importance of a baseline value, to have that as we head into, seniorhood, and maybe 2 or 3 years from now, it'll be really beneficial to look back when things were normal to have those normal values for your pet. Other than arthritis and chronic pain, certain heart conditions are more common in some breeds over others. Also, I think, again, the dental disease is a big issue that a lot of people assume is not a problem if their animal's eating, but animals, again, they hide things. And having a bad mouth or a bad tooth is often the cause of systemic illness, and so I think that being aware of that is equally important. I also think nutrition is very important, and having that discussion with your veterinarian is very beneficial, and it completes the picture. I think nutrition is often not looked at enough. Also, weight. I think it's the tendency for a lot of our older dogs to get a little heavy, and there have been numerous studies showing that dogs that are more at an ideal or slightly lean body condition can live on average about 2 years longer. So talking to your veterinarian about weight and how nutrition plays into that is really a good idea. I just think that with cats, again, being really good at hiding things, they often will lose weight as they get older or drink more water. And I think those are little clues, or maybe they're just not jumping up on counters as much, or they're not as interactive. And I think all of those things, again, are reasons to get a baseline. So I'm a big advocate of age is not a disease, and I truly believe that, but I also feel that we need to be informed as we move on with our animals into their senior years so that we can feel comfortable knowing that we're doing everything right for our pets that we love so much.